You don't have to fall off a horse or lead a dramatic life to have your spine go out of place. In fact, except for professional athletes, most such injuries do not come about from abrupt motion or impacts, but happen over a long period of time as a result of poor posture while lying down, sitting, or standing. Why is this? When a person is resting and their muscles are relaxed, their bones are more susceptible to being forced by gravity out of position. And from this, over time, more twists and turns are caused, resulting in all kinds of chronic pains in other parts of the body. Examples might be a short-sighted person who hunches over his or her laptop, or hunches over their phone or tablet when looking at social media, or who sits in a poorly designed chair, or wears poorly designed or worn down shoes that force their head and neck to go forward to balance themselves when standing, or sleeps on a soft or lumpy mattress, or uses a pillow that is too low or too high and so pushes the spine out of alignment. These all can push the spinal bones forward. And by now you know what follows. Okay, so let's get started on the real solutions based on the core principles of ABC chiropractic. First of all, how can you tell when you have a mattress, pillow, seat, or shoes which properly supports your spine? Before I get into the actual structural mechanics and specific things to watch out for, good and bad, there is something for you to directly notice, and that's called indicators of your body. While you are lying down on a bed, sitting in a chair, or trying on a new pair of shoes. Developing an awareness of these indicators will absolutely enable you to succeed on an unwinding program with me. Simply look for one or more of the following indicators on your own body in order to tell if something is good or bad in the position your body has taken. Do you feel stable and upright in a new pair of shoes? That's good. Rather than hunched over? Not good. Are you breathing deeply without effort in either shoes or a chair? That's good. Or is your breathing shallow and difficult? Not good. Is your face flushed? Good. Or pale? Not good. This last one tells you whether your circulation is improved by the posture created by chair, shoes, or bed. Are your muscles relaxed? That's good. Tense? Not good. If you are finding it difficult to perceive these indicators when lying down, sitting, or standing, then you can run this simple test. Take a deep breath. Let it out and allow the body to slump, if that is what it does. If your body remains upright at the end of the breath with no added effort to do so, the test shows the thing you are testing, whether shoe, chair, car seat, or else, is good. If your body obviously slumps forward, the item is not good for your posture or your health. Keep in mind that the more you get corrected in the clinic, the more that you will notice these indicators. So if you don't notice them right away, don't take a loss on it. You will eventually notice these things. If not right away, then as your body unwinds, just start looking. Now let's look at the tried and proven structural do's and don'ts of all the resting positions and the mechanical reasons why. This is the real nuts and bolts. Let's start with lying down on beds. The mattress that you need to use must be firm, and firmer than you think. I've had many patients tell me that their bed is firm, but when I start to ask them about it further, it truly is not, and not enough. So if your mattress is already considered soft, it fails the test from the start. The reason why people go for the softer beds, or think that they need a soft bed, is because it supports their compensations, all their twists and turns, while they lie on it. If you remember from earlier videos, the body twists itself into compensations in order to balance itself in gravity and to get away from pain. During my program, if you truly want to achieve a healthy spine and structure, your bed must be fully supportive to support the changes that occur and allow these compensations to let go. For those convinced that softer is the only way that they can be comfortable in sleep, I'm almost 100% certain that their pillow is too low when they tried the firmer bed on their side. With the correct effective height of the pillow and firmness of the mattress, you'll surprisingly find that the pressure points along the side of your body that you're sleeping on disappear very effectively. More on that later. If you find yourself sleeping in other beds, such as at family, friends, or hotels, you may find the mattress is soft or otherwise inadequately supportive. Here is a great life hack or solution when you find yourself in this situation. When you wake up from lying on a hotel bed or in the old family clunker all night, drink a glass of water, then immediately lie on your back on the floor for 10 minutes with a thin pillow under your head for comfort. After this, walk around in bare feet for 10 minutes, swinging your arms up while you do it. This will help you shake loose the compensations that the bed caused to you overnight. And good news, this will be increasingly more effective the more you progress on your unwinding program with me. I'm often asked, what is the best sleeping position to sleep in? On your back, on your side, or on your stomach? Well, the usual answer by most other types of practitioners is on your back. However, the correct answer is sleeping on your side is the optimal position for your spine. Why? In terms of comfort, when lying on your back, the spine has no option to rotate into a comfortable position. In terms of alignment, for long-term health, with lying on your back, there is the liability of pushing bones forward, especially if the mattress is soft. Lying on your stomach makes you twist your neck too far for comfort for most people and can cause problems as well. When you sleep on your side with the correct pillow height to allow for the pressure points to diminish to 0 or near 0, you will cause the least amount of winding up, and any that you might cause will easily self-correct with a bit of walking upon wakening. As for the pillow, you want to find one that keeps the head slightly above the horizontal line. Usually pillows, whether hard or soft, are too low to begin with, so you need to add more to the pillow to give it an overall thicker or higher level. There is a way to know that a pillow height is perfect, but you'll need to either purchase my clinic adjustable height pillow with different thicknesses of cloth covered foam, or try to make do with combinations of pillows and folded towels. The pillow that I sell is very worth the investment because it's an exact height that differs for each body and bed firmness. By the way, the firmness or softness of the pillow is entirely a personal preference. It is the effective height once your head is on the pillow that is important. So here it is in a nutshell. Starting with a firm bed, if the pillow is too low while lying on your side, the upper shoulder will roll forward like this. If you have overcompensation by raising your pillow height too high, you will find that the upper shoulder will roll backwards like this. When you have exactly the right height of pillow, your body and face will relax. Your breathing will flow smoothly. Your pressure points along the side of your body will disappear, no matter how firm the bed. The upper shoulder will stay in place, and your eyes will tend to want to stay closed. This last one, the eyes getting harder to keep open, is the most important and final sign that you need to notice. Once you do, this is the right height. Therefore, the time to do this test is not when you're tired, as your eyes will, of course, want to close regardless, and will ruin the test. This will be the last and final indicator, your eyes wanting to stay closed. Thanks for your attention, and keep in mind that this is for your quality of life and health, and will make a difference. In the next video, I will talk all about sitting and explain why this is the most misunderstood position of all. And the correct way to set up your sitting surfaces is to keep your spine from compensating and on the road to a continuing unwinding and healthy body and structure.